Hi everyone, this is Kate Warnock coming to you live from the GuideWell Insights Lounge. We're here with Dr. Bruce Hamory with Oliver Wyman. Bruce, welcome to the interview.
Thank you. Pleasure to be here.
Well, we're excited to have you here at the Oliver Wyman Health Innovation Summit. I was wondering, you're a physician, you're Chief Medical Officer for Oliver Wyman, and you very much have the provider's interest at heart. I was wondering if you could tell us a little bit, how do you counsel physicians who are expected to balance delivering innovative care with mandated changes and the consumer expectations that they're now expected to practice their medicine in?
Right. Well, it's a, as you say, a very unique time, very stressful for physicians and other providers. Lots of burnout, unfortunately, and a lot of people, unfortunately, thinking hard about leaving the practice of medicine. So, very important question. I think several things. First, we've trained physicians over time to do everything themselves and to take total responsibility for everything. And so part of this is about learning to work with others as part of a team, learning to trust the nurses and the MAs and the people you work with, learning to delegate a number of tasks that historically a physician might have done himself or herself. For example, giving shots.
Right.
I still meet physicians who give their own immunizations or administer penicillin, for example. So that's part of it. The other piece is working with other physicians closely, whether you're in private practice or employed or in a group, so that you can regulate your call schedule. Not be on call, 24 hours a day, 365 days a year. And that's one reason, obviously, that many physicians now and others are trying to seek employment by a hospital or a health organization. Another piece of it, very honestly, is as the payment mechanisms change, so that there's more attention to population health, more at risk, more results share, sort of payment. As that happens and you're expected to take care of a larger panel, a larger group of patients or people, you need to expand the team. And part of the trick there is finding a partner to help support that, whether it's the insurer or a health system or another party, because it's that extra help. It's the mid-level advanced practice person, the physician assistant, the nurse practitioner, a social worker, or other sorts of healthcare professionals that can come in and relieve some of this enormous strain on the physician. I think, unfortunately, the regulations are not going to become less onerous.
Right. We just had ICD-10 implemented this month.
Well, that's exactly right. And that's a short, fortunately, that's a fairly short-term thing, and most people don't have to worry about the code for getting sucked into a jet engine, so they can concentrate on their own area. But that's certainly coming up on a computer system is a big one. Making sure that your coding and billing is correct, and you have ADA access to the office. I mean, you can go on and on with these things. So what we do is advise people to look at where they are, gauge where the healthcare, the practice of medicine, the practice of healthcare in their own area is going, and how rapidly it's going, and to try to be in pace with it, not too far ahead, not making big investments that you're not going to be able to recover from the payment system yet, but working on the infrastructure that's
kind of
needed.
an just-in-time sort of
Yes.
approach, maybe?
Yes,
Right.
exactly right.
So if I can say it back to you, it sounds to me like what you really advise is considering a team-based care model
Yes.
for your delivery, but then also having the right partners for your back office
Right.
and ensuring that you really have that balance.
Right.
So I think that really leads us to the next question, Dr. Hamory, where we all know about the triple aim. Triple
Yes.
aim has been, really bandied about quite a bit with good reason. I don't know how many people may have heard of the quadruple aim. And the quadruple aim suggests that it's as important to consider the health practitioner's well-being as it is the other focus of affordable care and,
Yes.
and right outcomes and such. So how is it that the health industry can better support the health practitioner?
Yes. Well, it's a key, and I think for those who remember when Don Berwick was at IHI in his first iteration there, and the original transformation of primary care efforts were started, joy in practice was one of the elements, and redesigning the care so that people felt good about the care they gave, had a reasonable work-life balance, and were fulfilled in their work efforts. And so, for example, getting the nursing staff away from simply filling out paperwork and making phone calls back into the exam room so that they were doing more with the patient actually was very fulfilling for the nurse.
Absolutely.
And the goal of the process redesign was and remains, work smarter, not harder, get home at a certain predictable time so that you can, have dinner with the kids, put them to bed, and that kind of thing. I think, another part of it is how do we teach people to use technology? How is technology configured so that it actively supports and facilitates practice instead of being viewed as a hindrance? And I talk to physicians on both sides of that. Some say, well, it's better because I don't have to write 6 prescriptions, but I'm spending way too much time typing. Right. And I've seen others, and actually worked at a place for many years where the IT and the clinical groups had worked together so that a lot of the information could be entered by the nurse, could be entered by a set of screens that were rapid in their flips and used branching logic, and even a reasonable amount of information in later time was entered by the patient. And so, as you think about the practice of medicine, the source of truth is ultimately the patient. And whether you write it on a wax tablet or a parchment and quill pen, or you put it in a computer, it's all coming from the patient in terms of the history.
Right.
And so there are systems now that will allow a patient for specific illnesses, arthritis, congestive failure, to enter that information directly, and then it can be dealt with by the computer and arrayed in a way that makes sense to the physician. And so the physician is not having to go into 16 parts of the medical record to find all this stuff.
Right.
So, I think those are key issues. Work-life balance is a big one. That comes to call schedule. It gets to how the office is going, and do you have help to deal with the inevitable patient who has multiple problems and a terrible social situation, and do you have resources for that?
Right, terrific. Well, I think you inadvertently led me to my next question, Dr. Hamory, in that it's so critical these days, especially in this new care delivery system that we have, that the voice of the patient is really considered. And you were just mentioning how critical it is, who's the owner of everything. It is the patient themselves. Right. How do you see scaling that input, the consumer's input, and making it become more systematic, more clearly adopted, and actionable through the care delivery system?
Very, very important, and not simply because of a move to consumerism, but because the patient has always been, or supposed to have been, the center of medical practice. And I think that increasingly people are understanding that decisions need to be, the patient's decisions need to be informed, and that as clinicians, we are obligated to do what the patient wishes to have done. And we can certainly educate them about what their options are and what the likely outcomes are. It's sort of the Montessori method, you know.
But being very honest at the same time.
Yes,
and that's I think another conversation maybe for another time. But I'll let you
no,
finish
absolutely.
yeah.
No, that's absolutely right. I mean, I think candor and transparency and honesty in this are absolutely important. The other piece is understanding the family, because I think all of us who practice medicine have seen situations where you've had a conversation with your patient and they may have said, I do not want to be on a respirator. And then you have a family member who comes from, 1,000 miles away, who has not been intimately involved with dad's care or mom's care, and they say, oh, you got to do everything. Right? And so having the family engaged in that is also very important. So, and of course the constraint on this from the physician's point of view is generally time.
Sure.
Because these conversations require sit down, face-to-face time, and yet it's one of the most important things a doctor does. And it's another reason that as people think about designing a practice or designing a set of interactions with a patient, as much of the non-doctor stuff as you can move away from the physician to the patient, to the computer, to the medical assistant, to the nurse, to the PA, and preserve that trusted confidant, coach relationship, that physician-patient relationship, which is what we all go into medicine for, which takes time, right? It's not a 5-minute interaction, it's not a 12-minute interaction. It may take half an hour, or it may take several half-hour or longer conversations. And yet that's the essence of it, because that's what leads people to reasonable decisions about what their health care desires are. And at the end of the day, that's part of what drives healthcare expense is, we put people in ICUs and all kinds of tubes in and all that. And I haven't met anybody who wants to die in an ICU with 16 tubes. So, but absent those discussions and those decisions and the recording of those decisions, that's what happens, because we've set up a system that just keeps going and going and going.
Right. Well, this has been a wonderful conversation, Dr. Hamory, and I know that you're going to enjoy the rest of the Health Innovation Summit. Thank you for joining us here today at the GuideWell Insights Lounge. I look forward to speaking with you again soon.
Thank you for the chance.
Thank you.